Welcome to the second part of the pregnancy videos, where we will talk about the common pathologies that you may see with pregnancy, and we're going to focus on primarily musculoskeletal ones, but we'll talk about a few other ones when we talk about contraindications and precautions to exercise. And then we're going to develop an exercise program. So we're going to start with diastasis recti, and that is essentially referring to a separation or a split down along the linea alba where the two rectus abdominis muscles meet. And yes, I know that's not a pregnant woman, but it was the best picture I could find. And so you can see when the person is straining, pulling up, that you see the bulge right along the midline of the linea alba. And so with the increase in intra-abdominal pressure, forces abdominal contents out through that split. So of course, normally the two sides of the rectus abdominis should be knitted together at the linea alba, and basically with the increased size of the abdomen with pregnancy and the weakened condition of the muscles and the laxity in the connective tissue, all those things combine to create a split, and then with force it allows the contents of the abdomen to come through. And what you see on the far right is just the therapist testing for presence of the diastasis recti. And I'll just note that in your Kisner and Colby book, all these pathologies are described, so you can refer to the pregnancy chapter and the common pathology section of your book. Of course, we've talked about SI joint dysfunction and low back pain. Those really are never normal. Like pregnant women shouldn't just expect to have that pain. They are common, but not normal. So it is common because, again, of ligamentous laxity, postural changes, biomechanical changes. It is common to have those pain in those areas, but not normal. So, but what I mean by that is the person shouldn't just think they have to live with that pain. They should be able to get it addressed by a physical therapist and have it resolved. We can see some varicose veins occur in women that are pregnant because, again, of the relaxation of the smooth muscle. We talked about the pelvic floor muscles a little bit. So this is an inferior view, and so basically you're seeing, of course, posteriorly you see the vertebral body, the vertebra, the SI joints here meeting with the ilium, and of course the pubic symphysis anteriorly. So what's holding up all the abdominal contents from falling down through the pelvis is what we call the pelvic floor. And so we have one of the main muscles called the levator ani. It's actually made up of two muscles, the pubococcygeus, going from the pubis to the coccyx, and then the iliococcygeus from, of course, the ilium to the coccyx. And so there's one on each side, and they create pressure around the rectum. You see here one that you should recognize, the obturator internus, and then in the back another one, the piriformis. So these are providing some stability. But in general, we're looking at the levator ani kind of creating a sling around here. So those are some of the more important ones, and these can be stretched or torn again. And so we will be looking at some ways to do exercise to strengthen these muscles, and you'll be talking about those with your case studies. That's really all I have to say right now about the pathologies. We'll come back to these in a little bit more. I want to go on then to the effects of exercise during pregnancy, and we want to look at the impact on the fetus as well as the impact on the woman. So we're going to start with the impact on the fetus. And there really has been no negative effects documented when a person does mild or moderate exercise. And there, I would say, has been kind of inconsistent or evolving information being gathered about the effect of strenuous exercise. There is some evidence that engaging in strenuous exercise for more than 30 minutes will decrease uterine blood flow. So in other words, decrease blood flow along the umbilical artery and through and then therefore through the placenta, and oxygen through the placenta and into the child. So it can create some hypoxemia in the fetus. But we have to be cautious with these results because it does depend a lot on the fitness level of the mother, and we'll talk more about how to adjust for that. The other thing that we do have some evidence for is, again, this vigorous exercise, so prolonged strenuous exercise in the third trimester can result in slightly lower birth weights of the child by about 1/2 pound to 1 pound. So it may not seem like the biggest deal, but birth weight is, of course, one of the ways that we ensure the child is healthy. Normal birth weight is about 7 pounds, and what we would want to see, many children weigh a little bit more than that, but we really wouldn't want to see a child weigh less than 7 pounds. And so, that 1/2 pound to 1 pound could diminish or lead to a little bit less growth and development of the child. So our take-home really here is that mild to moderate exercise is perfectly safe. And so some of the improved benefits we've seen is that for women who are obese and would be prone to gestational diabetes, exercise can definitely diminish that risk. And we, of course, studied diabetes last semester. We know the benefits of exercise can prevent and, of course, diminish the need for insulin in women who are in people who are diabetic. So we also see a similar benefit of exercise on those at risk for gestational diabetes. We know that exercise can limit excessive weight gain, and while the woman needs increased nutrition to support the fetus, we don't want that to get too out of hand. We, of course, know that exercise can improve psychological well-being, and we talked in the first video about some of the emotional and cognitive effects of pregnancy. So exercise can maybe allay some of that anxiety or improve insomnia a little bit. And then there is some evidence for shorter labor and less pain perception during labor, though that is still kind of up for grabs. Don't really know if that's true. So we definitely see safety with mild to moderate exercise, and we see some benefits with exercise. There are definitely women who, when they're pregnant, should not exercise, and we're going to go through the contraindications and precautions for exercise. So women who have what's called an incompetent cervix should not exercise, and this is essentially premature dilation of the cervix. So the cervix is the area, of course, at the bottom of the uterus, and it's supposed to stay shut all the way through full term. Obviously, we don't want the baby coming out early. And it's not until the woman actually goes into labor that the cervix dilates and allows for passage of the baby. So with an incompetent cervix, that will dilate early and stimulate premature labor. So that clearly is not something that we would want to see. If a woman is experiencing persistent bleeding throughout the second and third trimester, again, that's telling us something is getting out. There's something's getting out through the cervix, and we don't want that to happen. Placenta previa, I think we looked at this before. This is when the placenta, instead of being up on top of the side of the uterus, is down on the bottom. So a couple things. It's covering up the cervical opening, which is a problem during birth, but the weight and the pressure of the baby on the placenta can diminish transfusion of nutrients and oxygen into the child. So that would be a contraindication to exercise. So of course that's the kind of thing that would be noticed on an ultrasound. Again, anytime that we start seeing things leaking or coming out of the uterus inappropriately, so if there's a loss of amniotic fluid or clearly premature labor, I don't think these are big surprises to you that these would be contraindications. Some conditions of the mother. If the woman has heart disease, There's probably a certain degree, but that is listed as a contraindication. If the woman has hypertension, this is noted. This is called preeclampsia when it's occurring in a pregnant woman. And again, she may not have hypertension otherwise, but hypertension during pregnancy is preeclampsia, and that can create excessive stress on not only the mother but on the infant. If the woman has restrictive lung disease, of course, we studied that last semester. That means your lungs can't inflate for some reason. Could be related to the lung tissue, or it could be related to surrounding structure in the thoracic cage. We said before that as the size of the uterus increases, it's going to diminish the ability of the diaphragm to contract and drop, so that the person can take a deep breath. So the person's going to have restrictions because of the pregnancy. So if they have restrictive lung disease, that would be too much stress on the respiratory system. And then finally, a woman who has severe anemia. Again, red blood cells are what carry oxygen around, not just to her body, but to the infant as well. And so with the stress of exercise, there may not be enough red blood cells and hemoglobin to adequately supply tissues with oxygen. So those are our contraindications. Precautions to exercise would include multiple gestation. In other words, a person with twins or triplets or quadruplets or quintuplets or whatever, who is at risk for premature labor. So it doesn't automatically prevent them. I mean, they would look at the tendency for premature labor to occur. Normal anemia, not severe anemia, so that would need to be monitored, along with clinical symptoms of, shortness of breath and fatigue. I said we would talk about fitness level. So a woman who has an extreme sedentary lifestyle and has a poor level of fitness, or one who is very obese, you want to be careful about the intensity at which you'd start an exercise program and how that exercise program would be progressed, though there still could be benefit. And again, musculoskeletal complaints that a woman might have, those complaints should be addressed and rectified prior to the person starting an exercise program. If you have someone who's a heavy smoker, hopefully they are not smoking during pregnancy, or if they have negative health consequences from the smoking, like chronic bronchitis, those would need to be addressed. And then finally, the last set of precautions are if they have a seizure disorder, hyperthyroidism, or type 1 diabetes that are not well controlled. All right, so we want to talk about exercise routines. And there is a group called the American Congress of Obstetricians and Gynecologists, and they have developed, just recently have updated their guidelines for exercise. And so that's really what I'm sharing with you now. And if you look in the resources of at the references at the end of your lecture outline, you'll see a link to this web page. But they definitely focus on exercise being enjoyable, as we've always talked about, but with a big emphasis on safety. And so they definitely recommend that if you're not sure, to err on the side of safety. And so one of the stories I remember and like to relate is that when I was pregnant, I was biking quite a bit, and so I would typically bike in the morning before I came into school, usually 15 to 20 miles at a time. And so I was about 3 or 4 months pregnant, and I was out biking on a backcountry road, and I ended up coming to a situation where there was a car coming up behind me, there was a truck in the facing lane, and so the three of us were kind of all in the right across from each other, and there was a shoulder on the road. Unfortunately, it wasn't paved, and it was a drop down of about 2 inches from the paved asphalt, and so I ended up having to go on to the gravel shoulder, and I was going pretty fast, and so I ended up wiping out. And so I wasn't hurt or anything, but I was really scared and shook up, and of course I was about 8 miles from home, so I had to bike all the way home crying, and went in and got an ultrasound, and everything was fine. But it really taught me a lesson that no matter how good you think you are at anything, when you're talking about doing something with high speed or where balance is involved, you just never know what can happen, and so the risk to the child just isn't worth it. So after that, I was relegated to exercising on my exercise stationary bike in the basement, and my husband made me wear my helmet just because I was obviously prone to injury. So that's a very long anecdote, but you can see here that the American Congress of OBGYN recommend safe activities like walking or swimming, stationary cycling, low impact aerobics, even running or jogging, and racket sports. But they definitely recommend avoiding contact sports and things that are at high risk of falls like skiing, off-road cycling, gymnastics, horseback riding, things like that. You can see other things that are not considered safe. Scuba diving, that is another thing. I did avoid that when I was pregnant because of the oxygenation issues. Skydiving I don't think requires any explanation. And then hot yoga or hot Pilates because of the risk of overheating. So definitely recommend about 150 minutes of exercise a week, spread pretty evenly throughout the week. So just like with any exercise, we don't want to do it once or twice a week, but try to get to 4 to 5 times a week at least. The RPE is really what they recommend for measuring intensity, because people can have such different levels of fitness and starting heart rates. They really don't recommend using a target heart rate, but using an RPE of, and again, not exceeding 14, which as you know is somewhat hard. Warm up and cool down, just like always. Avoiding excessive stretching because of the laxity of the ligaments, but not eliminating it. So gentle stretching. The high intensity portion of the exercise, again, we want to limit that to less than 45 minutes. And so somewhere between 30 to 45 would be the most we'd want to see. 20 to 30 minutes would be kind of more of a typical target. And again, that would depend a little bit on the woman's previous level of fitness. We definitely want to avoid overheating. We don't want the person in a humid environment, and so we want to make sure that they're not in that environmental situation. We know we need good fluid intake, make sure they have nutritional supplement so that they're staying within their energy nutrition balance. Resistance training, perfectly fine, just like we would do with anyone, every other day. And as I mentioned before, we would want to not have them exercise in the supine position. We don't want anyone doing a Valsalva, but we certainly don't want a woman who's pregnant. And again, because of the safety and the balance and proprioceptive and ligamentous issues, we don't want any jerky or ballistic movements. So I've kind of sketched out a little bit of a basic exercise routine, which again I think is very typical from what we've done. And then what I would like to direct your attention to for you to work on is there are some exercises in Kisner and Kolbe that look at postural correction, abdominal strengthening, and you may also want to look back into the core strengthening segment in the spine chapters as well. Pelvic floor exercises, pay particular attention to the ways to increase strength and endurance of the pelvic floor. That's not the same as pelvic proprioception. So pelvic clock is when you're moving your pelvis forward, back, side to side. That works solely on proprioception. Pelvic floor are isometric exercises. Basically, you squeeze as if you're trying to stop the flow of urine. So with pelvic floor exercises, some of you may have heard them referred to as Kegel exercises. But I think they're more broadly called pelvic floor exercises now. We would never have a woman do that with a full bladder, so you'd always have them urinate, empty their bladder before starting these. The reason for that is if they squeeze those pelvic floor muscles with a full bladder, it actually can force urine up out of the bladder, up the ureters, and that can cause a urinary tract infection. So empty bladder, and there's a variety of ways to do the pelvic floor exercises, so just do a few with me. So first of all, I just want you to squeeze for 5 seconds as hard as you can. 1, 2, 3, 4, 5, and relax. And you want to make sure the glutes aren't squeezing. Again, these are the pelvic floor muscles, so you should feel the area around the rectum and the perineal area tightening, but not the glutes. So you could just repeat those 5 seconds as hard as the person can. Another way to do them is to do 5 very quick contractions as hard as you can. So you ready? Go. 1, 2, 3, 4, 5. The reason for doing them quickly is because when a woman coughs or sneezes, those things happen pretty rapidly, and you want to be able to close off and contract the pelvic floor in a quick manner. We can work on what are called the elevator exercises, and this is where you slowly increase and then decrease the force. So let's start with a very slight amount of contraction and hold for 3 seconds. So 1, 2, 3, and then tighten a little harder. 2, 2, 3, and then tighten now as hard as you can for 3, 2, 3, and now just go back down to that moderate level. Don't relax all the way, but about back to 2, 2, 3, and then 1, 2, 3, and now relax completely. So that's kind of the elevator exercise where you slowly increase and then slowly decrease the force, never completely relaxing in between. So there's a variety of pelvic floor exercises. The other exercises, of course, just general strengthening, some relaxation and breathing. So at this stage, we're done with the video, and I will direct you to work either together or on your own. There is one pregnancy case study, and as I mentioned, I will figure out a way for you to share some thoughts and ideas about that on Blackboard. All right, thanks very much for your kind attention.